The cones, lit up signs, and medical staff in protective gear. These have become familiar images in this age of the coronavirus. This is one step on the path to finding out if people have the virus. This testing site opened Wednesday at a parking lot in Arlington, a suburb of Washington, D.C. They're averaging about 6 patients an hour.
We don't want, well people coming to be tested.
Those coming through here have already shown symptoms and been referred by their doctor.
The patient will pull up in their vehicle to the second stop. That'll be the one time that they roll down their window. And trained personnel will ask them to open their mouth, lay their head back, and we'll do a swab of their tonsils way back at the back of their throat, just like you would have if you were being tested for strep throat.
This is one of several testing sites set up around the world, like in the Republic of Korea and Australia.
It presents no risk at all for anyone working on the site.
We can really go through a lot more people if we do the private vehicle approach. We've seen it work in other countries, and that was the approach we chose to take.
And confining people to their cars isn't just for convenience, but safety.
As you do the testing, as you can imagine, as someone tickles your tonsils, you're going to cough. And when you cough, you can aerosolize those secretions, and those can linger in the air for a period of time.
As cases rapidly rise in the United States, the sites are also helping address criticism about the slow rollout of testing.
Our staff are incredible. I think the amount of time that it's taken us to work with the county to get this center set up in just a really short period of time really says a lot about the team.
Staff recognize the limitations. Test results typically take 4 or 5 days.
You could get tested today and day 3 be exposed to someone who has the virus and doesn't know it, and so you're exposed.
But these medical staff know this could be one of the best defenses against a pandemic.
I think there is some value to people knowing.
Frances Coe, CGTN, Washington.